This is Healthcare Now, radio's trending now. Get ready for an exhilarating 30-minute ride through the latest topics driving change in digital health across the news and social media. Join us as our subject matter host takes the lead in uncovering what's hot and what's not. So buckle up and tune in to stay in the know.
Welcome to Trending Now on Healthcare Now Radio, where we explore the forefront of healthcare innovations and transformations. I'm your host, Shahid Shah. Today, we're really excited to have Dr. Christine Gall, Chief Nursing Officer at Collette Health. What's trending now, and what Christine and I will discuss, is the transformative role of AI in virtual patient observations and how it enhances patient safety while supporting healthcare workers. We'll also explore the balance between human-centered care and technology in the age of AI. We're going to have a lot of great discussions here. So welcome, Collette. Tell us a little bit about yourself and what you do, Christine, at Collette Health.
Thanks so much, Shahid, for the invitation. I'm very excited today to talk about something really passionate to me. Collette Health, we have been at the forefront, as you said, of innovation. And I'm very excited to talk about some of the challenges that we're facing, which also give us opportunity. One of those is workforce shortages. We all have seen the numbers. It's in the news virtually every week that there are organizations that are either deciding to close or to limit services because of staffing. It remains a remnant of the COVID pandemic. There's been also a reduction of nursing tenure at the bedside, which has further challenged things, especially as the acuity and complexity of patient care becomes greater. And as well, all of these have culminated in some financial challenges, given the fact that nursing is the single largest cost to a hospital. Impacts to the cost of care and cost of labor definitely impact financial bottom lines, along with their decisions about services. So these factors in a nutshell have really led us to a place where the quality of care and the impact to care has really been addressed or impacted. When you look at these factors collectively, they really are contributing to an environment where preventable hospital-acquired injuries occur. And if you think first about falls in general, there are, across all hospitals in the United States, over 1 million patients fall each year. And the cost of inpatient falls collectively is about $50 billion. And when you think of the impact to a patient, the fact that following a fall, they are much more likely to develop symptoms of anxiety and depression, because obviously they don't want that to occur again. But maybe even more importantly, they don't want to lose their independence or their quality of life, which often are side effects of a fall. These are all very important issues. And then finally, another very concerning state is the fact that overall mortality rate related to falls in our older American population has over tripled in the last 2 decades, all concerning.
That's incredible. Those are pretty alarming stats. What sort of programs are hospitals putting into place? And I ask because just very recently, in fact, just over the last few days, I've spent probably 3 full days at a hospital with a loved one who needed that attention. It was interesting because they had a bed there, which every time the loved one got off the bed, it alarmed. And then somebody had to walk in and say, "Why did you get off the bed?" Well, like, I had to go to the bathroom, or I wanted to walk, etc. So it's this idea that tech will save us was kind of weird, because there was the tech. It was telling us that, just as one example, the bed did indicate that somebody got off the bed. It did not indicate why, how, did they want to, do they not need to, etc. So tell us, how are hospitals handling these challenges today?
You hit the nail on the head there. You're talking about a solution that reacts to something that happens after it occurs. And it really is highlighting an important issue. With limited purse strings, we have to make the right decisions about integrating the right technology into the right nursing workflows at the right time in order to create a safer environment for patients. So definitely we have work to do when it comes to avoiding preventable injury in this country. And I think virtual observation is the very first very first logical step into that direction. What virtual observation does, in essence, is it extends the reach of the bedside nurse, both their eyes and their ears, when they're not in the room, when they're most concerned about those at-risk patients that they really need to protect from harm, from injury, from falls. And virtual observers actually act as that wonderful extension. The nurse at the bedside treats them just like they would other members of their care team. They give them bedside shift report. They update them throughout the shift so that observer is armed with the most important information that they need in order to manage that patient and address the needs and keep them the most safe. So that's an incredibly important impact. The benefits to the nurse is that their day becomes less reactive. They have fewer call lights, they have fewer bed alarms, as an example. It enables them to complete everything that they wanted to do for each other patient when they're outside of that at-risk patient's room with fewer interruptions. Obviously, they can do things faster in a more logical and integrated way, which impacts their efficiency, the quality of the care that they're providing every single patient, as well as their ongoing resilience. I think we can all appreciate a day when you have your calendar organized with all of the things you want to complete so that you don't have any tight deadlines, and inevitably that first call of the day comes and your entire calendar is forever changed. That's the life of a nurse, and it's one way that virtual observation can benefit. The benefits to the patient, on the other hand, is that they have more touch points. They see that virtual observer as their companion, a member of the care team, and it overall impacts their feelings of safety and well-being and the sense that they are genuinely cared about. The virtual observer becomes their trusted companion and truly enables them, once that trust is established, that they can quickly either anticipate or intervene early and redirect patient when they're about to embark in a potentially at-risk behavior. Overall, this provides patients with a heightened level of safety and comfort during their hospital stay.
Yeah, it was very cool because what you guys are offering is basically what I was playing the role as over the last 3 days with my loved one. I was not a virtual observer at all. I was a physical observer, making sure everybody connected to everybody, ensuring that content was, when the nurse shifts change occurs, often where people drop things, and so. This sounds really interesting. Now, the issue is that the healthcare industry has been talking about AI's role for quite some time now. It has been sped up with generative AI. But there's always a concern about how we're going to utilize AI. And so in that regard, like thinking about me as a physical observer, what is the difference between a physical observer watching things versus the virtual observer? And how would AI be a good tool to empower elevating that practice of nursing at the bedside?
Great question. Back in the olden days, what used to happen is just as you described, Shahid, it was a physical person sitting in a room with a patient one-on-one. And there was, in the nirvana days of perfection, there were enough sitters to sit in those one-on-one patient rooms. Today, with all of our challenges, that is not the case. And indeed, some of the sitters are not effectively trained to do that. So they are physically in the room, but falls are still happening. The incidence of, observed falls with a one-on-one sitter are pretty dramatic. So virtual observation, leveraging observers who have the tools and the expertise to do that skill in an appropriate way with the appropriate patient who can be redirected is an ideal scenario, because it allows them not only to watch one patient, but up to 12 patients simultaneously. Obviously, that reduces the cost of care, expands the network of safety for which patients can be supported by, and obviously extends the reach of the nurse. So it's really important to give that observer skills and tools to do that. And AI is one of the best ways to leverage virtual observer expertise. In essence, it gives them superpowers, ability and the ability to do more with less time. So some of the features that we talk about are things like motion detection. Basically, what that does is AI is trained on a room and can see that there are multiple patients or multiple people in a room potentially at the same time, can distinguish between the patient's visitor and the patient themselves and staff that come in the room. And when that patient moves, if they are ambulatory, if they're able to move, that camera can follow them around the room. So that's called follow patient technology. I think I mentioned motion detection. That's a little bit different than follow patient. Motion detection is actually where a patient, obviously they have times where they are awake and times when they're sleeping. And when you are on the observer side of the lens, and you are observing up to 12 patients, you will tend to want to spend less time watching the patient who is in a solid sleep than you would patients that are active. So you can actually move tiles around to put patients that are sleeping in a lower level of your line of sight. But what this technology will do, motion detection will say, alert you, this patient is just waking up. And as a result, they're just waking up. And guess what? You can then intervene softly, remind them where they are, and say, welcome them back from their sleep, ask them how it was, reorient them to the room. Because I'll tell you that critical period of time between sleep and awake time is a period when falls happen most because confusion sets in. So a couple of other AI-driven technologies are hospital-acquired pressure injury monitoring, where the software can actually identify patients who are at risk for pressure injury and determine if they haven't moved from a certain position that could impact a bony prominence and therefore cause some degree of pressure injury given a certain time. So that, again, is all seamless to the observer, but the technology, AI-driven, alerts them when they might need to let a nurse know, or even ask a patient if they are awake and directable, hey, can you sit up? Can you change to your other side? And then another AI, it's not actually very engaged with AI, but it's extremely important, is something called third-party join. It's where the observer might sense that a patient is having challenges at a certain time, and maybe a beloved family member is the person who can really help them when they're suffering the most. So they can set up with the nurse the ability to bring a third party virtually into the conversation, directly into that room, to help with that patient's overall sense of well-being, keep them calm, and make sure that their needs are attended to. So all great examples of how AI can enable human-centered patient care.
That all sounds very cool. I mean, in terms of the last 3 days that I just spent in a hospital, I feel bad that I didn't have this at the hospital that I was at, but I'm excited that this is now available, that you guys are actually pushing this out, because that third-party join would have kept me from not having to spend 3 days there, because I didn't know at what time would they wake up and need me. Same thing with, so I had my sister and my wife. We all spent nights or days there just to make sure that they had somebody that they knew was there, because we all know that being with family does improve healthcare in general for people that are in hospitals. So if you're just tuning in, you are listening to Healthcare Now Radio. This is Trending Now. I'm your host, Shahid Shah, and I'm talking to Dr. Christine Gall at Collette Health. And we're discussing how virtual patient observation is literally transforming patient safety and empowering healthcare professionals. I was just giving the example of how I've just gone through this for the past 3 days as a physical observer, and it would have been really nice to have these virtual observers. So, Christine, I understand your platform teams help teams be more proactive. I'm curious, how has virtual observation changed healthcare environments over time? And do you think that it's going to eventually lead to more proactive data-driven interventions? And how far away are we from that? I just spent this 2024, I just spent 3 days because a reasonable sized hospital near where I live in a big city, Washington, D.C. metro area, just didn't have these capabilities. So where are we, and how soon can we see this everywhere?
Well, the good news is it's happening today. The volumes of additional data that are collected by virtual observers is immense, and the need for loved ones. And sometimes it's, thankfully you had the option because you were geographically, obviously close to your loved one. That isn't always the case. So it's so very important that we are able to leverage technology in different ways to address the needs of the day, which are, in essence, what some of the complications of care and some of the causes of the safety challenges we have. The opportunities for all of this additional data that's collected allows that bedside nurse to really expand and extend their assessment of the patient, get more granular because they have more information coming in with which to evaluate what's happening with the patient. They can also make sure that they can better anticipate what's needed for that patient to get them well, to get them back home with their loved ones. And, this access to additional information can also impact patient outcomes in so many significant ways. Just in the last 12 months, Collette Health, our virtual observation platform, has documented over 99,000 falls avoided just with our patient group. But you know what? There's incredible stories behind that impressive stat alone. Let's talk about one patient. He'd been in the hospital for over a month, and they had to have one-on-one sitters with him. He had no family members that could visit him. He was extremely scared. He was very reactive, sometimes got aggressive because he didn't understand what was happening. And, he got very close to his one-on-one sitters. However, the hospital struggled with providing that because oftentimes they had to take that one-on-one sitter out of direct care where they might have been caring for 16 or 20 other patients. So that became a challenge. They decided that they were going to try virtual observation. The sitter introduced them to the virtual observer. The patient was intrigued. They were like, wow, this is interesting. Just that new thing really it kept their interest and kept them calm. They also were fascinated by the fact that whenever they wanted to, they could call the observer and the observer would come on screen. But when they weren't on screen, there was a virtual fish tank. And the patient was also equally interested in watching the fish go by. He named the fish. He talked about the fish when people came in the room, and it was a source of enjoyment. What it did to the staff, obviously, is it kept staff at the level of practice that they needed to, caring for many patients. Also reduced the amount of one-on-one time. That patient wasn't totally free of one-on-one time. They recognized when those high need areas of time were in the day, and they would put an observer in the room, but they were able to free that observer up and reduce their one-on-one time spent with that patient by over 50%. So that's one incredible example. Another is, and this happens countless times, when well-meaning visitors will come in, bring a patient their very favorite food or drink, not recognizing the patient is NPO because they're about to go to a procedure, and the observer is able to identify it, address it, and make sure that the patient doesn't partake of that food or drink, and that avoids that need to reschedule that costly test or diagnostic, which is so important to care. And then the last example I'd like to highlight is that virtual observation has also provided safety for the staff. In one example, it was a brand new observer. They were just learning, and their trainer was sitting side by side next to them, and they witnessed a patient lunge at a nurse, grab her, and grab her very, very sharply, and that observer immediately sounded the alarm. There happened to be a charge nurse right outside the room. And because of the swiftness of that alert, that nurse was spared from any harm, obviously shaken up, but was prevented from harm. And we all know the staggering stats. Nursing is becoming an increasingly challenging profession from the perspective of violence. 2 nurses every hour in this country get injured by patients in the hospital. So it's definitely another side effect and one of the few stories of the full and complete impact of virtual observation.
Yeah, that's such a good example because just while I was at the hospital, I noticed a lot more signs indicating violence will not be accepted here. And I'm like, why do we need so many of these signs? And that point that you were making is absolutely valid. So let's talk about the patient side of things. I think we've got a lot of good benefits on the care provider side, but with virtual observation and AI, how do patients react to these technologies? And in the example you gave, it looked like that one gentleman reacted really well to it. But how does Collette Health's virtual care services support the patient's experience of care and extending that to the family as well?
Yes. Well, it obviously starts with selecting the right patients, the patients who could respond to virtual care. And it's paramount to identifying the right patients. But even before that, there are several things that are keys to successful virtual observation. First, we need to make sure that nurses buy into this. So even before we implement the technology, we need to do our due diligence at helping nurses understand why this is important, talking about, the safety issues with their patients, talking about the ability to give them an added resource, extra eyes and ears to monitor those patients that are always in the back of their mind, even when they walk outside the room to go to their next patient. Oh gosh, I should be in there doing this, or I'm really worried that they might do this, that they have the confidence, that they have a team member that's going to support that. And also, they need to understand what's in it for their patients. Their patients have greater touch points with staff. They get their needs addressed. The social isolation that often comes with hospitalization is minimized. And guess what? That nurse is going to learn all the things that they wouldn't have known otherwise. And it's often the nurse enters the room, the patient says, "Oh, I don't need anything." And 2 seconds later, they say, "Oh, I need something," and call on the call light, which brings the nurse bouncing back into the room. Well, the observer, when astutely interacting with the patient, remembers all of the things that patient was talking about and then prompts that so that cares and needs and requests can be grouped. So it's really important. That's an important piece, is developing that awareness and desire in the form of the nurses so that they are truly engaging, and then working with the observer themselves to make sure that they become the trusted observer and the nurse can trust them. On another level, the role of leaders is so very important. Having a nurse executive champion, virtual observation is a nurse-driven program aimed at improving patient safety. So getting the executive nursing champions on board, talking the talk, and making sure that they are delivering those key messages in every location they can when they are connecting with their staff, the nurse managers on each unit, that they're creating that culture of acceptance and adoption. Once all of that is in place, then definitely implementation of virtual observation happens, and it starts with that conversation between the nurse and their patient, helping the patient understand that we're giving you, as part of your safety plan of care that's been designed just for you, this virtual companion that's going to give you additional personal access, personal touches, will enhance your support, and will make sure that you remain safe and that your needs are always identified and addressed promptly.
Yeah.
And, that I think is just really the, at a high level, the very key elements of a very well addressed virtual observation program that a patient will say, yeah, I really value this.
No, I love it. And in fact, I was amazed at the range that nurses have. Like, in an hour, the variety of different things that they have to do is at a minimum complex, if not perplexing. And it was just funny because I spent a lot of time in hospitals for IT and other reasons. This one just happened to be with patient care. But my sisters and my brothers and aunts and uncles who are coming by, they're like, why didn't the nurse do this? And why didn't the nurse do that? And how come she didn't remember this? And why did this happen? I told the nurse this 2 hours ago. Why didn't they remember that? And obviously these nurses are human and they're just not going to be able to do all of this. And it just seems like having this kind of tech fit the gaps that are inevitable. I mean, there's no way that these gaps don't exist, means that you still have a lot of human-centric kinds of things that have to get done. So just in the last few minutes that we have, let's talk about this idea of human-first AI, because we can't get the humanity out of this. How do you maintain that balance between what humans should be doing and what machines will be doing, even though machines might be better, or humans might still need to do it, or vice versa? What have you guys learned at Collette Health about that really, really tender balance?
Yeah, I will tell you that in my mind, the true value that AI will bring to care delivery, it has started and it will continue to expand, is keeping the humanness in healthcare. AI is going to do a couple of things. First, it's going to address those lower level tasks, is what I call them, things that keep nurses from practicing at the top of their licensure, knowledge, and expertise. It's things that were created back in the days. I will date myself now, that I started nursing before the EHR was created. The workflows were so different. Workflows today don't even compare. And when I think about how those workflows have changed, so many things have to happen in order to connect electronic and digital technologies and information, and a lot of those conduit or flow through nurses. That has to be mitigated, and AI is definitely an opportunity to do that. On another plane, AI is going to help collect. There's information overload when it comes to data that are available on a patient, but AI can help collect, aggregate, and delineate and understand and analyze those data so that they are packaged in digestible bites for nurses real time, so that they can act upon what's happening with that patient. So again, they can practice at the bedside more, be away from the bedside less. And so AI, I think, when appropriately implemented, is going to elevate the humanness of nursing care.
No, I love it. And in fact, the way that to kind of summarize this as we finish up here is that there's a lot that AI can do, and even in my recent visit, most of the things that it would have helped with is just making the patient and more importantly his or her family feel better about all the complex things that are going on. And so those poor nurses, I saw them because I deal with EHRs all the time. Every time they left the room, they were over there typing away. Luckily, they weren't doing it directly in the room, even though there was a computer there. But a lot of that is where the issue comes in, where if the nurses, every time they came in, they were just talking and focused on the patients, and they could let all the observations and everything happen behind the scenes, that I think would be fantastic. So Christine, I want to thank you so much for taking time and giving us your insightful perspectives on AI, because when used thoughtfully, of course, we can really, really transform patient care. So before we wrap up, I know that you guys are going to be at a conference soon. What conference is that?
Yes, we are going to be at the ANCC Magnet Conference in New Orleans at the end of October. And I would love to ask your audience if anybody is going to be there and would love to speak with me directly. If they want to ping me on LinkedIn, I would love that. I would love them to follow Collette Health on LinkedIn, or even access our website at ColletteHealth.com. And at the Magnet Conference, we will be at booth 1531. Feel free to visit us there and learn more about our technology and how we can partner with you.
To our listeners, thank you for joining us on Trending Now on Healthcare Now Radio. Stay tuned for more episodes where we explore the latest trends and innovations shaping healthcare's future.